everyone, Polly Schneider, the Executive Director of the Sheboygan Area Chamber of Commerce. I am here today with Chris and Theresa from the McLaren Health Management Group at the Sheboygan Hospice House, formerly known as the Vital Care Hospice House. Hi ladies, how are you today?
Great. Fantastic.
Thanks for having us here today. Can you tell me a little bit, what services does McLaren Health Management Group provide?
Absolutely. We offer home care, palliative care, hospice services. We also have long-term care pharmacy. Our laboratory services run through us as well as our Care Now clinics.
Okay. Can you maybe tell me and the people watching the video, what are the differences with home care, hospice care, and palliative care?
Absolutely. Home care is a Medicare certified program for skilled care. So if your loved one was in the hospital, oftentimes home care is ordered on discharge so that we can provide education, perhaps wound care, maybe there's IVs. So it's a skilled need, it's intermittent in care, and it's not meant to be long-term.
Okay.
So we have caregivers, the family becomes the caregiver.
Okay.
For palliation, palliative care is one of those programs that's unique in the sense that it's been around for years, but not everyone understands it.
Okay.
We've taken the approach where it's a nurse practitioner based separate program. It's not part of home care, it's not part of hospice.
Mm-hmm.
So our nurse practitioners, along with the patient's primary care physicians and other specialists, are managing chronic illness at home.
Okay.
So your loved ones who might have heart failure or COPD, an unstable diabetic, and truly they're coming to the home, they're working through and educating, they can order different tests in the home and prevent those readmissions from happening to our hospitals.
Okay.
Hospice care is truly end-of-life care. The one thing I think to take away is that hospice is not, we take care of patients in the final hours, but truly it's a program that lasts 6 months or more, depending on how the patient is doing. We're looking at a slow decline, and we're to help them transition through life and write their story as the final chapter should be.
Right. So kind of keeping along the line of hospice, what is one thing that you would like people to know about hospice?
The one thing I would like people to know about hospice is the wonderful program that it truly is. Families say to us time and time again, and I know this is cliche, but I wish I'd have known about this program sooner. We do, as I mentioned earlier, get a lot of last-minute referrals in the final hours, but quite honestly, with the opportunity to start servicing that patient at 6 months, and again, that's a doctor's best guess. But the care we provide, the support we provide in the home, the quality of life that we're able to help that patient attain, it's a beautiful program. It truly is, and not to be afraid of it. As I mentioned before, you know, we live a life full of chapters, and quite honestly, the final chapter should be an accumulation of the way we lived our lives. And to have a program that encompasses the family and the patient, and then we provide aftercare, is one that we all should be tapping into when it's that time.
Absolutely. My family has gone through that in the past few years, and it really is a wonderful program. Everybody that we've met and worked with was fabulous and really helped us through a really difficult time.
Absolutely.
So it's definitely a great program. How can people enroll in the program?
Well, quite honestly, for hospice or palliative care, you can just call our office and request that a nurse come out and talk with you about the programming. If hospice is agreed upon and the patient is appropriate, we just need an order from the physician. With home care, we need that physician order or coming directly from the hospital from the physician there, and then we just initiate that care and talk with our physicians ongoing.
So fairly easy process to get enrolled and get assistance and help going through that final stage. Are volunteers involved in any of the programming?
Absolutely, they're very much involved with our hospice program, and we actually need them as part of our conditions to be a part of our programming. So we're always looking for new volunteers. We do a lot of different things, quilt making. They do special projects with us if we're doing an event. So they're not just bedside volunteers, but those who would like to be a bedside volunteer, we would love to have you.
And I imagine there's probably some special training to kind of go along with volunteers, and I'd imagine that it would be rewarding and emotional to do that. So there's probably some training and things that go along with that.
There's training that goes along with that.
Excellent. So ladies, is there anything else you would like us to know while we're having this little chat here in this beautiful room at the Hospice House?
I just think, honestly, I've been involved with hospice for most of my career, and I think that we need to, as a community, embrace the programming that's offered. You have your choice, you don't have to pick us, but this is a beautiful location if your loved one should need this type of care at the end of life. So I look at hospice as the program of hope, and I would hope that the rest of our community would think that as well.
Yes. So in just a minute, everybody, we're going to introduce you to someone that can help you if you want to become involved as a volunteer with the hospice program. Well, thank you so much, Chris, for answering these questions and letting people know a little bit about what the McLaren Health Management Group does. And now I'd like to take a minute and speak with Theresa Weil. What would you like to let us know, Theresa, about your position and what you do with McLaren Healthcare Management?
So I am the account executive for the Northern Region, and which includes obviously Sheboygan area, and we just have a fantastic team of caregivers for all of our services: home care, palliative care, and hospice. I can't say enough the wonderful things that they do every day.
Yeah, it's a great program, and you guys are great to work with too, so we appreciate that relationship, learning about what you guys do, so we're able to help tell the story for you to our community here in Sheboygan.
One other thing I would like to add, if there's any groups out there that would like us to come in and provide education to their community members, such as an Elks Club or a church group, we would love to do that. I think the more you know, the better decisions you can make as life moves forward.
Absolutely. I know the next person that you're going to meet just met with the Chamber Ambassadors last week, and she gave a great presentation on how they can get involved with volunteering and just some of the day-to-day type things that happen here at the Hospice House. So now in just a minute, we're going to come right back and meet Logan, the new volunteer coordinator here in Sheboygan. All right, everybody, we are back. This is Logann Poley. She is the new volunteer coordinator right here at Hospice House in Sheboygan. Congratulations on your new position and welcome to the community, Logann. What would you like everybody to know about Hospice House here in Sheboygan and what you do with your position here?
Yeah, definitely. So the Hospice House is a wonderful place for people to come volunteer. Our patients here are always looking to have people just provide companionship for them. But I also work a lot with our patients who are located out in the field as well, in their own homes or in other facilities, and working with them and their families to make sure that any needs that they have for companionship or respite care are also met. And so I work with our volunteers to get them out in the field and schedule them, and I do a lot of recruitment, so if you're interested in any of those volunteer opportunities, I'm the person that you would call and reach out to. But our volunteers also can do a whole lot with, like was talked about earlier by Chris, with office work, filing, fundraising, community events, everything like that. So anything that you might be interested in, doesn't have to be direct patient care. We can find a place for you with us, and we're just excited to grow our program.
Yeah. So we will have the contact information for Logann at the end of the video, or you can always call us at the office too if you're looking for it and can't find it. We'll be able to connect you guys. You did mention respite care, and that might be something that some people don't know about. So can you just briefly kind of give us an overview of what respite care is?
Yeah, definitely. So respite care, when it comes to our volunteers, is a 4-hour block of time. It could be less, but usually never more than 4 hours. That a volunteer could go into generally a patient home and sit with the patient while the caregiver could leave to go run some errands or things like that. So just to be eyes and ears and peace of mind for that caregiver to be able to go to appointments or errands or
just kind of give them that little break that I know a lot of caregivers do need, because they do work so hard taking care of their loved ones.
Yes, definitely.
Yeah, so great. Thank you so much, Logann. We are so excited to have you in Sheboygan. And again, we are here at the beautiful Sheboygan Hospice House with our friends from the McLaren Healthcare Management Group. Thank you, everybody.